My name's Adrian Pisarski. I'm National Shelters Executive Officer. It says here I'm excited to facilitate this session this morning, and I actually am. So they've even got my notes right. So just so you know you're in the right place, this session is Homelessness in 2017, is Early Intervention and Prevention Working. This is an audience poll session. So you will need your PACE conference app ready to go on your smartphone or device, but please make sure your phone is switched to silent. To participate in the live polling, just tap the live polling icon on the home page of the app, and I will be sure to provide plenty of notice before we're about to launch into a poll question so you can get your device ready. So I want you to do that now, because before we hear from Gail Gilman this morning, we will have the first app question. So if you can get those things ready, that would be terrific. If you are having any trouble with your app, you can flag down one of the helpful staff in the bright red #NHC Sydney t-shirts, although that's going to be difficult in a dark room. And you can, of course, ask a question in the old-fashioned way from the floor. Just signal to one of the mic runners or make your hand signals to me. We will get the lights up at that point when we're ready to do that, and I'll try and negotiate that with the questions from the app as well, and we'll get a microphone to you. So let's first get... Well, let's not do the app yet, the question yet. Today's session is, as I said before, Homelessness in 2017, is Early Intervention and Prevention Working? And the format for this session will be an introductory presentation from Gail Gilman from Community Housing Partnership USA, followed by a cross-panel discussion and audience Q&A. Some of the key points and questions we hope to cover off in the session include: which options present the best way forward for addressing the funding and outcomes gap in homelessness services? How much is the absence of options through discrimination in the market of the loss of community-owned and controlled services? And how well is the sector moving from crisis response on the one hand to early intervention and prevention, or what some people call housing first, housing-led, housing plus? Our participants in this session will be Gail Gilman, the Chief Executive Officer for Community Housing Partnerships USA, Professor Guy Johnson from the RMIT University. He is the Professor of Urban and Housing and Homelessness there. Jenny Smith, who most of you will already know, who is the Chair of Homelessness Australia. Sherri Bruinhout, who is the Assistant Director, Homelessness and Accommodation Support from the Department of Health and Human Services, Victoria. They have very long departmental names in Victoria. We have Darren Young, the State Director for Queensland and the Northern Territory from Mission Australia, and Paul Hardcastle from Housing and Homelessness in the Department of Social Services nationally. And last but certainly not least on the panel later will be Lacy Baron, the Director Strategic Policy in the New South Wales Department of Community Services. If you want to know more detail about our participants in this session, you can read their biographies on the app, and please do that. Just before I introduce Gail Gilman, we'll get that first poll question up if we can. Okay, so question 1. With a commitment to ongoing funding, is our homelessness system sufficiently resourced for early intervention and prevention? And your options are: yes, there's plenty of dough. 2, it's just the same but funding is now ongoing. 3, there will never be enough money, rather. And 4, it is not just about the money. So can we start the clock? Okay, and the result is... Did we get the result? Oh, there it is. I can't see it from there. It is yes. Ooh, I better read it off there. 0%. I can't quite see it on that screen. My glasses aren't with me. Sorry. Oh, thank you. Nobody thought we've got plenty of dough. 12% thought it's just the same, but funding is now ongoing. 17% said there will never be enough money, and 71%, that's a big number, said it is not just about the money. I think that's quite an interesting result. Thank you, Anthony. A lesson to me, wear your glasses. All right. Now, it's my great pleasure to introduce Gail Gilman now. As I said before, Gail is the Chief Executive Officer of Community Housing Partnerships USA. Please make her welcome to the stage.
Thank you. Thank you, Adrian. Briefly, before I get started on my presentation, I wanted to pause just for a moment. This is my first time here in Australia, and I want to thank Aurori for inviting me to make this presentation tonight. I also want to acknowledge the Gadigal people of the Aurori Nation who are land I'm on today, and I wanted to pay my respects to elders past, elders present, and any who are with us. Thank you so much for having me. I'm humbled to be here today. Okay. So first, I'm going to walk through a little bit. Oh, it would be great if the screens could be switched, but that's okay. I'm going to walk through a little bit homelessness in the United States. And kind of how, whoops. That was dramatic. So homelessness in the United States is dramatic, and I'm actually going to switch over here so I can see the slides. So just very briefly, the United States, we've always had individuals who've been homeless, but we had some things that have happened over the last 30 years that really have made a huge impact. One was we closed institutions that used to house individuals, particularly individuals with severe mental illness. In the 1970s, the United States decided that drugs were not good. And we started a war on drugs, which has led to mass incarceration. We have one of the highest incarceration rates in the world. We stopped building public housing altogether across the country because we decided everyone should be able to have enough means on their own, pull themselves up by their bootstraps to afford their housing needs. And then welfare reform came along under the Clinton administration and decided that women in particular who had children who were poor could not receive benefits if their husband or spouse lived with them. So there was a mass exodus of fathers from households all across the country so that women and children could qualify for public benefits. Criminal justice reform in 2010 was positive, but it led to an influx of people leaving incarceration back to communities with nowhere to live. And the Affordable Care Act, which has provided health care for everyone, has also incentivized hospitals and institutions not to keep people in those hospitals. So people are being discharged to their communities with nowhere to go. All of this is sort of the conclave of why we have the homeless crisis in the United States we have today, with over 500,000 people viewed as homeless. The federal definition for homelessness, not local municipalities, is it's someone who is staying in a shelter, a transitional housing setting, or someone who's sleeping not meant for human habitation. This number here does not include people who are overcrowded or people who might be living in situations with no running water or electricity. This is just the definition, again, shelter and not meant for human habitation. And as you'll see, California has 20% of the overall homeless population for the United States. And in the Bay Area, where I'm from, we account for 20% of the overall homelessness in the state. So as you'll see here, San Francisco is the highest. Please remember, San Francisco is 7 by 7 square miles with a population just tipping 800,000. So we have almost 10% of our population, or 7% of our population experiencing homelessness. And then these are the other counties that surround us. So what we know about the homeless population, particularly in the Bay Area, is that 71% of them were living in some sort of housing prior to their episode of homelessness. 90% were California residents. 64% are unsheltered, meaning they're sleeping on the street. Your phrase, I think, is rough sleepers, compared to the national average of, whoops, oh, sorry, I screwed up. Let me go, I don't know how to go back. Let's see if I can go back. Sorry, I apologize. Right, here we go. Sorry, I'm so embarrassed right now. I'm mortified. You're a lovely audience. So 64% are unsheltered versus the national average of 31. And of what we call transition age youth, which are individuals 18 to 24, most of them are exiting home care. 86% of them are unsheltered. So a huge difference in subpopulations. And what we know is that 10% of the most high-need homeless individuals in San Francisco account for 70% of all costs. So they're high utilizers of care. So in San Francisco, we're really trying to focus on chronic homelessness, which there are currently 2,100 individuals who are chronically homeless. Chronically homeless means you've been continuously homeless for a year or more and have at least one disabling condition, or you've had 3 episodes of homelessness in the last 4 years with the disabling condition. These are viewed as the hardest to serve. You see here demographically also the breakdown, which surprises most people, that most chronic homeless individuals are single white males. I think something you should know for San Francisco, which is important, is San Francisco overall population, 6% is African American. They make up 33% of the chronic homeless population, and they make up overall 64% of the homeless population. So why are we in this crisis with rough sleepers? Part of it is the fact that we've incrementally increased our shelter supply over the last 9 years. And what you should note is the majority of our shelter are for women and children, or parents with children. Very little, 19%, is for single adults, and they make up almost 100% of the chronic homeless population. And then when we look at supportive housing, which we'll go into a little bit, which is different, or I would say is a slice of your social housing, you see the inverse. 77% of all the beds are for single adults and only 23% for families. So there's a correlation between why we have the shelter system we have and we have this system. And then just really wanted to highlight the difference between what we view as the 2 segments of the homeless population. Overall homeless, mental health, substance abuse, medical fragility is in the 40s. When you look at the chronic homeless population, it jumps by almost 20 percentage points for people suffering mental illness, substance abuse, criminal justice involvement. So it's very unique challenges to deal with our 2,100 homeless, chronically homeless people in San Francisco alone. The mayor of San Francisco wants to try to end chronic homelessness by 2025. He won't be the mayor, but he's off to a good start. So we do know one thing. We know that when you're unsheltered in San Francisco, these are all San Francisco numbers, we as a system spend about $80,000 a year on you. We know that supportive housing is $20,000 to $30,000 per year per person, all inclusive. And this is all inclusive of costs. This is medical costs, emergency room costs, welfare costs, the whole package for those individuals. So why is San Francisco struggling so much? We are lucky. We're one of the only West Coast cities that has not seen an overall rise in homelessness. We've stayed flat at around 7,000 people for the last 5 years, but we're struggling. So first of all, we are one of the most expensive housing markets in the country. I think we have that in common here with Sydney. I've been walking around looking at home pricing and buying. I can buy in Central Park if I have, I guess, $1.8 million. So you share that, but we have a very expensive housing market, and again, we're geographically bound. Our changing demographics have seen multi-generational families leave San Francisco. So folks, when they come out of incarceration or hospitalization, do not have a safety net or that familiar family that they used to have to help them readjust. And we have, which I'm sure is a shock to all of you, and maybe we could poll on this question if this is true here in Australia, but we have zero cross-coordination, data sharing, and a fragmented homeless system. We have over 27 databases that data sits just in the city and county of San Francisco for homeless individuals. And the mayor in 2015 announced the creation of a homeless department. He's pulled all the staff and all the data, and he's trying to create coordinated care across the city, which is a game changer, but it's been fragmented, it's been broken. And I know we have some government officials coming up, and they'll say how this is absolutely not the case here. I'm excited about that. And there's not enough beds to house everyone. So when you don't have a place for people to go, in the United States, our Justice Department at the national level has said it is a crime, it is a civil rights violation to ask homeless people to move if they're encamped or sleeping on the streets if you don't have a place to offer them. So as we saw, we have less than 2,000 shelter beds. We have 7,000 homeless people, so we have large encampments happening all over the United States, particularly on the West Coast. And then we have an affordable housing gap. So as you see, 64,000 people are extremely low income, and we'll get to what that means in a minute, and there's only 23,000 housing units for them. So the whole housing market's being compressed. A family that might be working, making $40,000 a year, who maybe had an apartment, if they lose that apartment, they're then going to a lower rung of housing they'll rent. Many families are living in single rooms with shared kitchens and baths down the halls in what we call SRO hotels. 5 years ago, those families would never live there. Those could have been for people who were poor or working or just making it. So the whole market's being compressed, and people are going further and further down the rung of what they'll rent. So again, this is just illustrating the same thing. Average rent in 2016 was a little over $3,500 a month. This is at 50% of your income, and then 30% of your income if you are extremely low income. So we're going to get to a slide that's going to show you those numbers. But as you see, this is your income. You can't afford to rent if you're extremely low income right now in 2016 in San Francisco. Again, same sort of just belaboring the point. The median price to buy a home in San Francisco is $1.5 million. This data is from 2015. The median in the Bay Area. And people just can't do it. This also shows you that we've had an explosion of loss of housing in the rental market. We have 8% of landlords are sitting on their properties and not renting them. And we've only had a net affordable of a little over 1,500. We've produced 3,200 units in that same time frame. Half of them have been lost to people taking their properties off the market or doing short-term rentals. Do you have Airbnb here in Australia? Yes. So they're the culprit for us in San Francisco. Oh. They loaded the wrong presentation. So I apologize. We don't have the numbers on median income. So Community Housing Partnership was founded 27 years ago to help homeless people secure housing and become self-sufficient. And we do that by the following activities. We're a housing developer, a real estate developer. We do large-scale new construction, acquisition, rehab. So we're a nonprofit housing developer, similar to what you have here in Australia. We provide intensive support services on site, embedded in our properties in the lobby. We also provide employment services to folks. We believe homeless people can and should go back to work. And we also do public policy and engagement work. I am going to pause here, though, because, and I do apologize, I brought them a new presentation this morning because I've learned a lot since I've been here, so I'm going to improvise for a minute, especially for our panelists. So what I've learned since being here since Saturday is that here in Sydney, there's affordable housing. which my understanding is that's 20%, rents 20% below whatever the market price is. We don't have that in the United States. That doesn't exist. What we call affordable housing is a segment of what you call social housing. So for us, affordable housing is for individuals who make between, San Francisco just raised it, between 100 and 25% of area median income. So as an example, since we don't have the slide, for a family of 4, if median income is 100,000, they'll rent that apartment to people making 100,000 to people making $25,000 a year, in that range, and they'll mix up the units for income, and they're affordable. They have no rental subsidy, and they usually have 1 staff member for every 50 to 100 people doing service linkage. That's what we call affordable housing. And what I was going to say on a slide in challenge is, I'm asking, is there really pure supportive housing here in Australia, as an open-ended question? Supportive housing is only for people who are extremely low income, normally making less than 20% of that number, so $20,000 or less. It has all sorts of restrictions on occupancy, on guests, on entry. It has concierge services 24/7, and all of the social workers, nursing staff are in the lobby, in the building, 7 days a week, supporting you to become self-sufficient. So my question for the panels is, I know that model exists in Queensland because I Googled it and Common Ground came up, and I know it exists in some other places, but we really think this kind of housing is the solution for homelessness and the best way to prevent recidivism going back to the streets. And this is what we were founded to do 27 years ago. So you've seen our mission before. We view ourselves as a service organization that uses our real estate platform for our intervention. Now, without housing, homeless individuals cannot rebuild their lives and recover from that trauma. This is our housing portfolio. So as you see, we have a little over 1,300 units. We currently have 300 in progress that we're building. Whoops. Go back. And as you see, there's some slight variations in our model. This is our preferred model. Our preferred model is hand in glove. We do housing operations and we do services. We also do not believe that traditional property management or traditional, I think what you call here like tenancy support that you would do for people who are poor, we think it needs to be radically different for individuals and families that have experienced homelessness. So that's why we prefer to do it all together so that the outcomes for both units are tied. The outcomes for housing operations and services are interjoined. So how do we get from this to this? It's this. It is an intensive service model that is mostly not funded by government. 70% of it is funded by government. But we really believe this integration, again, of housing operations, engagement, services, that all of these are in service to our residents is truly key. That doing work on the front end before tenancy, so people understand what they're signing up for, is very, very important. Maintaining stable housing is huge. And then what you'll see in a little bit is we are piloting and moving towards, and have started the national conversation, that individuals should be moving out at some point. We know that our residents are stuck for affordability and that they have the ability to move out. We estimate right now close to 10% could move out tomorrow if they had an affordable option, opening up that slot for someone who's on the street. We have a very robust, I'm just going to get this up here for you, service staffing model, as you'll see here. This is one unit. We have 2 service units that assist our residents. This one is run by a director who is licensed, and we have 2 people here. One carries a caseload of 1 to 25, the other in the property 1 to 50. This is all early engagement, life skills, community. This is working on an action plan, rebuilding your lives. We have 4 domains of self-sufficiency we measure: tenancy and housing, mental health, substance abuse, and physical health, education, employment, and income, and community connectiveness and involvement, ending social isolation, and having individuals and families who cannot go back to work volunteer and be leaders in their community. This group works on those things. And then we have clinicians for individuals who have severe mental illness, severe healthcare needs, substance abuse, and they provide clinical oversight, and they carry a caseload of 1 to 15. So a typical team for a property of 100 units would be up here a team of 3 to 4, a team of on the ground 1, maybe 1.5. So we have to raise philanthropic dollars to make this happen because government doesn't support these outcomes. And then we also know folks can go back to work. So for individuals who want to, and this is our only program that's citywide for formerly homeless residents living in supportive housing, public housing, or affordable housing, is we train people in housing operations work. We train them to be concierges. And so they go through a learning program, and then at the end, they get to interview, and they come here. And this is what we call a social enterprise or a B Corp. I think you have those here in Australia, where we provide temporary staffing services to other affordable housing developers for their concierge services. And then they get picked up and hired. Last year, this business grossed $3 million in sales. 1.8 were wages in the pockets of the individuals who participated, and 60% of those who work here get hired into permanent, unsubsidized employment. For us, and I think it's probably true everywhere, I think folks want to be part of community, whether that's volunteering or work. It ties to self-worth, especially in the United States, and we find this program to be really successful. So we decided in 2015 that we were going to really pioneer better outcomes and moving on, having people be able to move out, which I've heard earlier speakers at this conference talk about, people moving out of social housing. We really want to stress that that can happen. So we took out the word permanent, which is a lexicon kind of language thing in the States. We just call it supportive housing. When I go to rent an apartment, no one says, "Hi, Gail. Welcome to your new permanent home." And we do this sometimes in the United States with homeless individuals, thinking it adds comfort. To us, I think signing a lease, paying rent is what you need to demonstrate to someone that this is not time limited or they're not at risk of losing it. We designed and piloted and launched a comprehensive Moving Beyond program. That service model was key to that. That service model's been in effect now for a little over 12 months throughout the organization, shifting the whole culture of how the agency sees its work. And by 2020, 10% of our residents will begin to move out each year or have the means to do that. And that's our big picture goals. So how do we do it? So a family starts homeless. They come to supportive housing. Families, we know, have different motivations than single adults, and it only takes 3 to 5 years for families to stabilize enough and be comfortable to live more independently. Then they qualify. They are self-sufficient. Those 4 domains I talked about, we're assessing our residents every quarter on those domains and how they're moving up them. And then they get to move. And right now, we have 3 options for people in San Francisco. Affordable housing with a subsidy set aside, because folks are still living in poverty. Our residents hardly break above 30% of AMI. So for that family of 4, it's 30. Maybe they get to 35 or 40% of AMI, but the majority of them will never break out of poverty. So if with us, they're paying a set rent, why would they give that up? So they need a rental subsidy or rental subsidy support for life. Public housing is another option. And then sometimes we get vouchers that we can use in the marketplace with private landlords. So these are the mechanisms for the Jones family to become self-sufficient. Same concept here, just showing it in a different graphic of a ladder. So we coined this the housing ladder, and it's our goal that everything we do connects back to it. What we've really learned is that keeping people housed is not enough. The long-term goal for us is to create a best-in-class supportive housing model. So individuals start off as homeless. They then enter our housing where they receive intensive services geared to helping that individual have the ability to move out and live independently. And they don't need us just so they can sustain. We established a goal that 100 of our residents will begin to move out each year starting in 2020, and another 500 will reach a greater level of self-sufficiency where they're connected to family and friends, volunteering, working part-time, and thriving in their community. We began to provide clinical, mental health, and substance abuse services by licensed clinicians. We're tracking how folks are managing their physical, mental health, housing stability, if they're abiding by the rules we have in our property, being a good neighbor. We then track education and employment. We know homeless individuals want to work on their educational goals and that they want and can and should go back to work. And then the most meaningful is connectiveness to society, to community, to friends.
I was having a lot of problems with mental problems. I had to go to the therapist, and I was diagnosed with 4 different diagnoses. So I am on medication. With the medication that I'm taking, it's helping me a lot. I think it's a matter of time before I can feel mentally healthy enough to do something, go back to work or learning something. I was thinking, maybe go to college, and horticulture is something I want to learn. As a matter of fact, I'm thinking I'm probably going to do that by the end of this year.
When Mayor Lee announced in 2017 that 100 portable vouchers would be made available to supportive housing residents citywide, CHP was ready. Nearly 130 of our residents applied straight away.
All I know is Assisi at the Hamley Motel, she told me there's a new program and it's about a new place to live and a voucher, Section 8 voucher. Are you interested? I said, oh, yeah. Voucher just came from the sky, but I never thought that I was going to get one. When they called me to say, hey, come over and take a look at this place and see if you like it. Of course I like it. But then when they say, this apartment is yours, that moment I was very emotional and I feel like for jumping, crying. I told them, that's too much. That's too much for me.
There's only going to be so many vouchers that are available each year. And so another way that we see an opportunity for residents to move out of supportive housing is by convincing developers and owners who own affordable housing to allow our residents to move in, either with portable vouchers or with prioritization for apartments that they have already that are subsidized. Once we've perfected this model, we believe it should be the standard of care across San Francisco and across the Bay Area. And we hope to scale geographically with this model to teach other providers how to use this model and have greater impact. Because we should want a society and a city in San Francisco where we have folks who have experienced homelessness giving back, contributing, and being truly integrated into the fabric of San Francisco. So this is the conclusion of my presentation. I apologize that we didn't have the 3 slides about Sydney on here, but I think I articulated the point I was trying to make. What I will say is we know that our intervention is cost effective, and we have proven outcomes that we track. And for our government partners, this is the most important one. 98% of residents who move in with us stay housed with us or stay housed out in the community because we track them, and never return to homelessness. So I hope this was instructive to all of you as you look at how to battle homelessness here in Australia. My understanding is there's 106,000 Australians right now who are experiencing homelessness in your country, and about 6,000 rough sleepers. And I hope the lessons learned in our experience in the United States can help all of you serve them. Thank you.
Thank you very much. Take the first chair because you'll be part of this panel discussion that we're going to move into. And If I can ask our other panellists to come up, and while we're doing that, we might load the second question, the polling question for you, if we can get that lined up. And during that, and whilst you're looking at your apps, I'll just carry on Carrie Hamilton's observation this morning that you never get to leave housing because it's like Hotel California. I'm a long-term resident of Hotel California in that case, because I started in this game some 35 years ago in Hobart, but I'd also observe that, and to differentiate myself from the Prime Minister, who couldn't name an AC/DC song, but he should have at least known that it's a long way to the top if you want to rock and roll. What we're really trying to do is prevent homeless people being on a highway to hell. Now, have we got the question up? We do. So your second poll question is, beyond certainty in government funding, my top priority for reforming the homeless system is innovation in non-government funding, greater housing first capability, service integration between employment, health and other things for prevention, better data availability and linkage, or a truly national approach. So we'll start the clock now. Stop voting. And I've got my glasses on now so I can read that screen down there. So what were the results that we had? So, non-government dollars, nearly 20%. Housing first, 37.3%. Did that just change from 0.8 to 3? Or was it my eyes? Data, 6.9%. That just shifted as well. And a national approach, 35.2%. So a bit of a spread of results there. All right, we're going to move into our panel, and we're going to just ask and start with Jenny Smith from Homelessness Australia to begin with her take on that fabulous presentation from Gail. And Gail, on behalf of Ahuri, we apologise for not having those few slides available. It's a difficult thing doing a presentation when you think you know what you're doing and then something doesn't come up. So on behalf of Ahuri, we're sorry about that. But Jenny, over to you.
Thanks, Adrian, and Gail, it's really great to have you here with us and have the opportunity to hear about the really inspiring work of your organisation. And we are in different environments in so many ways. I mean, the population of California itself is so much bigger than that of Australia, and we define homelessness differently, and you know, the basis of our human services is quite different as well. However, most of the issues you raise make us feel very uncomfortably at home with your presentation. We all know that our human services system here in Australia derives from our British colonial past, and what that means is that we have a fundamentally flawed system, but it has been, you know, reasonably fair over the course of our history. But unfortunately, our human services each year are gradually transforming to look more like the approach, the individualistic approach that's taken on your home turf. And so in considering the housing and support services that we have today, I think we have to bear in mind that our whole human services and health systems are tilted towards acuity and crisis in their approach. They're increasingly assuming individuals and families are responsible for their own problems. They assume that people are either buying their homes or have bought their home by the time that they retire. And so we don't have those services taking into account the cost of housing. We don't have a national policy or plan for housing or homelessness, and the policy settings that we have today really derive from the Rudd Labor government's road home policies of 2008-2009, and the investments we currently have in place are those that were put in place in the late 1990s under the SAP funding approach, and also the demonstration projects that we had funded through the NPAR flowing from that Rudd-Gillard period. And we all know that the last serious investment in social housing that we had was in response to the global financial crisis. So for me, the question's not is early intervention and prevention working. It's more how do we get it in place, because it hasn't been funded. I think as a country we've overwhelmingly embraced housing first, whether that be the sort of permanent supportive housing that you have illustrated so clearly for people experiencing chronic homelessness, but also we've embraced rapid rehousing for groups like women and children escaping family violence. I think we get it. I think we use the national partnership funding to demonstrate best practice right across this country that I think in many places can compare to what you've described today, Gail, although I think we'd also we're not as strong on the employment connections as we would like to and need to be. And states and territories have invested to extend our boutique and niche responses, and many organisations have used their own money, donations and philanthropic funds to do the same. However, we do have a shortfall of 500,000 properties that are affordable around the country to people on the lowest incomes, and outside of that niche innovation, not much has been happening. And I'll leave it to others to talk about. I think everybody understands the basic things that we want to see in a national housing and homelessness plan and strategy. My final observation, Adrian, just to reassure you, would be that we do have a great deal of permanent supportive housing across the country, largely in high density settings like Common Ground. We know this is a small group. We know that it's 5%, around 5% of the people we count as homeless every night in Australia. And practice wisdom tells us about half of those people would do very well with permanent supportive housing. But my understanding is to date we have very few examples in scattered sites. To date they've mostly been linked to psychiatric disability, and Gail referred to Micah Housing's Homefront team in Brisbane, and I know in Melbourne we have Co-Health's Homeless Outreach Mental Health Service as well. They're very high quality assertive outreach, care coordination programs in scattered housing site settings. Unfortunately, both those fundings are linked and will be consolidated into the NDIS, so it will fall to states and territories to keep them going. So I think what I would like to see is us thinking more about permanent supportive housing that's mobile, that can be linked into scattered housing sites, and as you say, as people's needs decrease, that it's not all linked up together and people can stay home and not have to move. Thanks, Adrian.
Thanks, Jenny. We're going to, just so that you know how we're running, we're going to go through each of our panellists just to get a short response, but I will get to your questions, and they are coming in on the apps, and I'm noting them down, so we will get back to them, and we'll also then turn the lights up. But next I'd like to ask Lacy Baron from New South Wales. We are in New South Wales, so it's appropriate that we hear from the local mob about how things are shaping up in New South Wales. Thanks, Lacy.
Thanks, Adrian, and thanks to Gail and also to Jenny in terms of providing that overview about what's happening in San Francisco and also what's happening more broadly in Australia. I think as the first government speaker, I do need to say that we would love some more cross-agency coordination and data sharing. It is obviously the bureaucrat in the room. We would just love that. It helps us in terms of, we think it helps us in terms of building our evidence and making arguments about funding and interventions and supports. But we also have been doing a lot of work in New South Wales around a new homelessness strategy, and our focus has very much been on prevention and early intervention. And when we went out across the state and in consultation with services and other agencies, it went back to that first question about the funding is not the only thing, and getting the links with health and justice and education and our partners in those sectors is absolutely critical. So it is something that we're very, very focused on. And I think going back to what you said around the good quality supportive housing services that we do have in Australia and in New South Wales, we have definitely built on the experience from the National Partnership, and in New South Wales we call it the Homelessness Action Plan, but those were in some ways the beginnings of those cross-agency attempts to look at what does a prevention and early intervention approach mean when we're looking at people with different needs, both in terms of the complex mix of different situations that have led them to homelessness, and how we can pull together services that more appropriately meet their needs and provide a pathway out of homelessness. So things like tenancy supports and early intervention with real estate agents, but also exits are a huge issue for us as well. So exits from justice, exits from hospitals, but also, exits from social housing and from out-of-home care as well. Those are critical tension points where our service systems aren't sufficiently integrated, and we need to do better in terms of transitions from people in those instances. But I guess in terms of what we're trying to look at is that we think that the service system, the specialist homelessness services, and the different projects that have been put together are very good quality, but we need to build them. We need it not to be a specific project in St. Vincent's Hospital, for example, which is an excellent group of services and supports in St. Vincent's Hospital, but how do we make these things more of a systemic response so that we have a better approach to early intervention prevention more broadly? But I think I might just leave it there, but I think that I think we have a really good base to build from, and we do want to look at how we can bring our other partners in health and justice and other government and non-government services so that we have a shared view about homelessness outcomes being a priority for all of us.
Okay, I'm going to stick with jurisdictions and ask Sherri from Victoria to go next.
Thanks, Adrian. I think it's worthwhile just giving a little bit of context in how we're seeing homelessness in Victoria. Like most of the states, Victoria has facing unprecedented levels of demand on our homelessness services and demand for our affordable housing stock, largely driven by housing affordability, which we've spoken a lot about over the last day or so. On census night, there were almost 23,000 people experiencing homelessness in Victoria, and about 1,000 of those people were rough sleeping. Our supply of social housing stock really hasn't kept up with the population growth and demand. The City of Melbourne's street count has seen a 74% increase in rough sleeping since 2014. And in conjunction with those factors, we've also had a Royal Commission into Family Violence, which has found the very real link between family violence and homelessness, with over 42% of people citing the reason for accessing homelessness services as family violence. And the Royal Commission having a raft of recommendations that government is working through. So in an environment where resources and services are increasingly targeted to those most in need, where a Royal Commission's recommendations must be acted upon, where the community are becoming more and more alarmed about the rough sleeping that they're seeing both within the CBD and within the suburbs and the regional areas of Victoria. A really important question arises in that environment, which is, what is the role of early intervention? And how have we understood early intervention in the past? And what's the role for early intervention in terms of moving and changing to respond to a changing environment? So the concept of early intervention as a service provision has become a much more nuanced concept to the one I knew as a youth worker back in the 90s, where early intervention was getting naughty kids to go back home to mum and dad. For early intervention to be successful, it must be cohort specific, and it must adapt to fit the needs and demands of those particular demographics. For example, intervening earlier to prevent homelessness for women escaping family violence is a much different proposition to early intervention for young people leaving state care. So the Victorian Government is working in a much more nuanced way in understanding early intervention. I just want to very briefly, Adrian, give a couple of examples of what I mean by that. So there's a program at the moment called the CBD Service Coordination Group. It's a very sexy name, I know. The cohort is for newly arrived rough sleepers into the CBD. So when I talk about a changing understanding of early intervention, we're not talking about people who have just become homeless. We're talking about people who have just landed in a particular geographic place. So they might have been homeless for quite some time before coming into the CBD. The approach is a towards home approach, which incorporates integrated service coordination, data sharing from first to know agencies. It's a housing first model that utilises flexible funds, assertive outreach, and a dedicated supply of THM and modular housing allocations. The outcome has been about being able to identify newly arrived CBD rough sleepers and divert them into housing with support at the earliest possible opportunity. One other quick example I'll give you is the private rental assistance program and the head leasing program, which the Victorian Government has been rolling out over the last 18 months. And that cohort is looking at people who have become newly homeless but who have demonstrated an ability to maintain tenancies in the past. So the approach is either head leasing or providing deep rental subsidies that taper off over time, and at the same time providing deep support, which also tapers off over a period of time, and that period of time is dependent upon the need of that particular individual. The outcome has been 900 sustained tenancies over the past 18 months. But the interesting part about that is that the cohort is very diverse. So that 900 sustained tenancies includes rough sleepers and includes people leaving family violence and includes people leaving institution environments that we were discussing earlier. So I guess what I would be saying is that early intervention used to be a bit of a blunt instrument that we understood in the sector, and now I think it's really turning into a much more delicate instrument that we're learning to play very differently to in the past.
Thanks, Sherri, and we'll just move straight on to Darren, who has the very small jurisdictional task of covering the Northern Territory and Queensland, which for your benefit, Gail, is probably about the size of Texas and California, throw in Arizona, and a couple of other states as well.
Thanks, Adrian, and thanks, Gail. It was really good to see the success of your organisation. It did make me stop and think, and I'm doing a bit more work in the Northern Territory at the moment about what our own success is and what are we doing in the Territory around homelessness. And for those who don't know, the rate of homelessness in the Territory is increasing gradually over the last sort of number of years. We haven't fundamentally addressed the issues of homelessness. What we're seeing, the national rate of 1 in 200. If you look at the Northern Territory, it's got 14 in 200, and if you're an Indigenous person, it's 50 in 200. You know, we certainly haven't cracked the nut on the homelessness issue in the Northern Territory. And I think us for a nation, if we're talking a national approach, the situation in the Northern Territory really needs some detailed thinking. But just a couple of thoughts. First off, when I'm thinking about early intervention, I kind of think about how early. You know, what do we mean by how early? You know, Mission Australia is often doing programs. We're working in the schools. We're intervening early with young people and families. But how far do we go back? You know, should we be doing more work in primary schools? Should we be strengthening young families? What can we do in the community to get greater ownership and connection in community to prevent homelessness? I think that's something that I'm very interested in, and it's good to see the NT government has just released a discussion paper on homelessness to start bringing in. They've just had a Royal Commission looking at the juvenile justice and also in child protection, domestic and family violence strategies, and I think cutting across the different sectors and having a much more holistic view about this the problem of homelessness, I think, is very much important, because essentially we're not talking about one problem. When we say homelessness, what's the solution to homelessness? It's not one problem. There's multiple drivers of homelessness that we need to be addressing. In some of the conversations we have with government, we're often talking about collaboration and coordination. I remember a minister saying a little bit harshly, if only the NGO sector would get their act together and work more closely with each other, we would get much better results. As a manager of a non-government service, you can imagine that put the hackles up on my back. Our immediate response was the method of contracting within our services certainly places us some restraints on how we work together. The other real issue is collaboration costs. And we need to be thinking about, when we are doing the work, how do we factor in the costs of collaboration to get better results? And I think thirdly too, I think I've seen some initial success, and we're involved in a project down in Katherine where it was very much focused around the individual and people coming together around individuals. That seemed to really motivate the collaborations and getting good individual success across a range of sectors. And I kind of like that sort of place-based approach, targeting individuals. I think there can be some things we can build upon in that. So I think for me, an overall bit of a summary, how early is the early intervention for me is a good discussion point for us, and how do we make the national approach be able to deal with the diversity we have across Australia.
Great. Thanks for that. We're going to move straight to the Commonwealth perspective now. We've heard from state perspectives and territory perspectives, but Paul, you want to pick that up?
Thanks, Adrian. I guess we'd say about early intervention, like we've heard from you, Sherri, and from you, Darren, about cohort specific. And that's one of the things we're looking at in the new national agreement, is how can we give focus to priority groups that are overrepresented in homelessness, and how can we actually, together with states, link up efforts across different areas of government and service systems to make differences. When we've gone out and we've talked to people about the new agreement, it's been quite clear and completely expected from the sector, and you've said it for many years, so it's not surprising, that we need to link up these efforts across governments. We need to link up the efforts across sectors. And so our hope is that this agreement, once we finally settle it, it will be a process of us actually starting to work more deeply with states and with the sector to make further progress. So we've indicated to states that once we move to bilateral discussions, we're quite happy and quite willing to work on what reforms we're doing. And some of those discussions have already started, and we're already working with the ACT on one particular reform around longer term housing and those kind of housing first approach, and thinking that through. The other thing, unfortunately, Gail, is that the data, we do unsurprisingly have problems with that. The Uhuri did a survey for us on research project into the effectiveness of the homelessness service system. And I've got some quotes here. They said in their report, there's limited evidence to allow for a comprehensive assessment of Australia's homelessness service system. It was difficult for Uhuri to do effective analysis, especially as the available data is often limited, fragmented, or not comparable. Evaluations do not use the same measure of effectiveness, and the quality of the evidence base is variable, with few solid independent evaluations of services. And there is a need for a whole of government approach to data collection, management and evaluation. So on a positive note, there has been in these discussions quite genuine commitment across all jurisdictions about the fact that we realise that we need to improve this evidence base, and a real commitment for us working together to do that. And under the new agreement, that's one of the key three things that we're seeking, is to improve the information. And so I think there might be some progress, and we're talking about doing this in a stepped, measured, collaborative way. So I think there is some hope.
Thanks for that. And last but certainly not least, and because good academics like to listen to everything and gather all of the evidence before they make a response. But also, I'd just point out, Guy coined one of my favourite phrases ever about homelessness, which I think is relevant to this discussion. It used to be on a shelter t-shirt, and it said, "Homelessness is structural violence." I think that's an interesting approach. He may have just been a lot younger and more feisty in those days, but Guy, over to you.
Thanks for that. Let me run through a couple of points that sort of, whenever this sort of discussion and debate turns to prevention and early intervention. We know through the Journeys Home study what prevents homelessness for disadvantaged households. That's public housing, that's education, and that's family support. That sits far outside the homeless service system. Now, Australia's in the unique position to have this really strong evidence base around what prevents homelessness. It's nothing to do with the homeless service system. And I feel for people who work in the home. I think the homeless service system, everything gets lumped into that system. You've got to do prevention, you've got to do early intervention, and you've got to work with homeless people themselves. That's too much. It sits well outside. The issue of early intervention, Sherri mentioned it's a more nuanced concept. It also becomes watered down and meaningless at times when you're talking early intervention with chronically homeless rough sleepers first turning up to Melbourne, with all due respect. Because the reality is that's not early intervention, that's what it's never meant to be. What that's going to produce is a perverse incentive where it will attract people into the centre of the city because there's a service offering there. We have to be acutely aware of these perverse incentives when we target specific groups. We also need to be aware from a sort of an analytical perspective that as you target specific groups, we know which populations are most at risk. It's very difficult to pick out which individual within those populations will fall into the homeless population. So that creates all sorts of problems in terms of targeting. Whilst the idea of cohorts is important, it's very difficult and it's not necessarily cost effective to try and pick out which individuals. And remembering another point, many individuals who experience homelessness don't have those risk characteristics. What happens to them? For many people who don't have characteristics of drug use, being in state care, who are simply experiencing an economic shock, loss of job or something like that, what happens to them? Are there no services for them? Do we not intervene early there? Or where does early intervention and prevention start for that group? So my biggest concern is that the homeless service system a lot is being asked of the homeless service system. And one of the sort of provocations I will put is, should the homeless service system be focusing on working with homeless people? Is early intervention and prevention, are they things that should sit right outside of that system and other systems should be picking it up? I will focus on one final thing, and that's on data sharing, data linkage and so forth. We have the infrastructure there to do much, to develop a much greater understanding of flows within systems. The reality is it's governments that prevent that. It's not academics, it's not peak bodies, it's governments not giving us access to that data. So if governments want better understanding of what's going on, they need to stop sort of writing up reports and saying we need more data, we need better data linkage, and actually open the doors. Commonwealth, state, both can do it. We'd develop a much stronger understanding of the flows between and within systems. The final thing I'd say is my latest sort of phrase is, whenever we look at something, I think we've got to ask the question, are we growing the system or are we growing the solution?
Thanks for all of those contributions. I think that's set up a lovely discussion for us, and if we can bring the house lights up so that I can have a chance of seeing some people. There's a few questions that have come in, a lot of them obviously for Gail, and I'm just going to ask you to respond to a couple of these at the same time, if I might, Gail. So the first one is really about vouchers for private real estate, and if you can explain how that works. It's not a really common thing here at all. And then also another comment that your employment program sounds absolutely amazing and deserves a round of applause. But if you can go into particularly the voucher system, that would be great.
Sure. So historically in the United States, the federal government, through their public housing authorities, have issued portable vouchers. that you can take to the private rental market, and if you pay $200 a month, but the rent is $800 a month, it pays the landlord directly the $400 balance. Historically, they've been used for families or individuals who are poor. They had massive wait lists all across the country. I think ours in San Francisco had like 8,000 people on it. Recently, across the United States, housing authorities have prioritized homeless individuals or individuals in supportive housing to have first preference. So, and I mean this with all due respect, our housing authority literally 9 months ago found 100 vouchers that they forgot about. And so they launched a program for supportive housing residents. They received over 600 citywide, and as I said in our video, 130 came from Community Housing Partnership. So they then get what's called housing navigation services to match with a private landlord. We do follow-up. Most other organizations don't. We do 1 year post follow-up. So that's how that program works. It's a voucher for life.
Okay. Jenny, there's a specific question for you. What do you think about the National Housing and Homelessness Agreement bilaterals?
Well, thank you to whoever asked that question.
I'll just point out it was anonymous.
I'll just hang on to my friend Paul here as I answer. Look, you know, every year for 6, 7 years now, we've had to fight for the NPAR money at this time of year and try and make sure that we're going to have it reassured, and we've now been advised that it's going to be in perpetuity. But we segue immediately to having to renegotiate a new National Housing and Homelessness Agreement. And I guess what I think about it is that we're talking about the existing funding that's out there for the NAHA and the NPAR, and not one more additional dollar. And in fact, we're going to have to make sure that we hang on to the dollars that we've got. I think we are being invited to talk about what we would like to see funded in a future housing and homelessness system, when we're really just talking about the money that's keeping our public and community housing and our homelessness services that are currently out there running. So I think if there's an overarching agreement reached, then we will be in a situation of some concern as each jurisdiction nuts out a bilateral. If there was additional dollars on the table that each state and territory were asked to match and undertake reforms and refocusing, that would be a very exciting proposition, but that's not the one we have.
Thanks for that, Jenny. And I might just
Paul wants to say something.
Sorry, Paul, go.
If that's all right.
Yes, of course it's all right.
I'd say that the new agreement's more about transparency, and it's more about us understanding where the funding's going. So for what we're seeking, and it is that thing that I talked about where we can actually work together to do certain things. So what resources do we have in the Commonwealth that can help states? How can we link things up? If a state, of course, might choose to redirect funds, that's not what the agreement's seeking to do at all. What the agreement's seeking to do is to understand what at the moment to, like, 1.4 billion, we know at the moment that it's spent on housing and homeless services. We would like to know a bit more than that.
Lacy or Sherri, you want to...
Oh, thank you, Adrian. I think for the states, we are focused on outcomes in the services and improving data across agencies and in services. We all are trying to work for the same thing, but I think when we're looking at negotiations, we think transparency costs money, and if we're talking about increased reporting requirements and increase administrative burdens, it means that's actually a reduction from our services, and that's not something that we want to see. I'm not sure if I was meant to say that, Adrian, was that what you were hoping for? But I think that's the tension we have, is that absolutely we all want to make sure that we get the outcomes out of the funding, but we want to make sure we're doing it in a way that doesn't take away from our services, which I'm sure is not the intention. It's just about being careful about how we implement it.
Yeah, I think, Sherri, go.
Well, look, I'm very happy to hear that we want to work in partnership and work together. We'll keep that in mind as the legislation gets rammed through at the federal level. But we're very happy to look at working together, and I reiterate the comments that that Jenny and Lacy's made, that money is well utilised by services that are beyond breaking point in a lot of our cities and regional centres. And transparency and better analysis is wonderful, but to be able to invest in that leaves a very difficult conversation about where do those resources come from, because they're very well utilised at the moment. But I do look forward to working in partnership, absolutely.
So, Gail, I was going to ask you, in Australia, we have this situation where our agreements and the funding that flows from them are negotiated between our federal Commonwealth government and state governments. It creates some issues in our context, and I was going to ask you to reflect on the United States and see if there's anything there. Do you have that same problem, or is it all state funded, or?
Sure. So the federal government in the United States has sort of one major vehicle that distributes homeless funding across the United States, and every year you have to reapply for it. And it's administered by our Housing and Urban Development Department. And over the years, they've shifted priorities, so what that pot of money has funded has changed, and it has a certain set of outcomes. One that I think is key is, which I think is a low bar, I don't think they're asking enough, is that 71% of homeless people remain housed. That's the national standard. You saw ours and many of our colleagues in San Francisco is well above that. Linkage to mainstream benefits is a huge one, and there's like one other. So it's not very deep. The cities and counties run those programs in a bubble, and then some states do a lot of homeless funding. California actually is a state that does almost zero homeless funding at a state level. They rely on their cities and counties to do all that work. Massachusetts, New York State have the highest allocations, so they're more in alignment. San Francisco now, with a singular department who's overseeing all of homelessness and supportive housing, says they have a goal to bring in alignment outcomes. But I was visiting with an NGO here in Penrith, and they termed a phrase I love. It's called grudge compliance. And I would argue that most of what we do with our government entities and partners is grudge compliance. We're measuring things or looking at things that are outputs, not truly outcomes, and then we have a whole set of measurements on the side that we use for our own analysis. I hope that was the point of the question, Adrian.
Okay, no, that's fine. But it leads me to this next question, and again, anonymous from the audience, but given that the clear evidence is that it is cheaper for government to house people than for them to be rough sleeping, is any level of government doing the financial modelling to show the long-term impact of investing in housing? And I guess that's really a question either for government representatives or Guy, you might have a sense of what the research is going on around that.
Yeah, look, it's clearly a tricky one. In the States, the cost argument's been particularly persuasive around chronic homelessness, but there's a sense here in which there is a bit of overreach as well in terms of the cost claims, and that can easily backfire. If you have a look at probably the best study in the world around housing first, which is around chronic homeless people, that's the Cheswa study from Canada, Canada seem to be leading the way in a number of areas. What they found was that for the this was working with the chronic homeless population, as we know there's some variation in that population. For every $10 invested, they sort of got about $9.70 back for the very sharp end of the spear. So they didn't even break even there. For the other chronically homeless who have a number of needs, it was lower than that. And the cost benefit analysis we did down at Sacred Heart came back with a similar figure. Now, this is about comparing program interventions. If you compare against the broader population, you're always going to make cost savings. So it's what's your base of comparison? And that's a really, really important point, because are we looking to save money, or are we looking at the intervention that saves the most money relative to other interventions? And that's one of the questions we haven't grappled with at the moment, particularly well, because we're just looking at the sort of the advocacy side of things. So I think we've got to be really cautious about that. And I also think one thing that we have to keep in the back of the mind, it's not purely an economic argument, it is just a straightforward moral argument around homelessness. Even if something doesn't break even, who cares?
Okay, that's a bit of a nice segue to this question, which I'll open to anybody at all. Has housing as a human right, or does housing have a human right, have a place in today's Australia? And if so, how can it be expressed? Anybody want to have a go at that? It is a famous slogan, housing is a human right, but we don't seem to hold up to it very well. I noted though, I'll keep going then. I noted in the Memorandum of Understanding in the introduction of the NAR legislation, if I can call it that, there is an explanation about how it helps Australia comply with its human rights obligations. So let's ask the Commonwealth, are we complying with housing as a human right?
So I'm not, the International Covenant on Economic, Social and Civil Rights, I think it is, isn't it? I would have to go back to the latest, because we get independently audited from that by the UN, because it's an international convention that we've signed up to. I think generally the way that all of those reports go is that pretty much for all countries there's a thing that says this is what you're doing well, and here are areas where you can focus on to improve.
Okay, Jenny, you want
I mean, the only comment I'd make is, you know, in a way to reiterate what I said early on in my remarks, which is I think, you know, the shape of our approach to human services, I think, have historically had some structural component where we have understood that it's in our interests as a community and in the interests of individuals to provide housing and to make sure that everybody is housed. But as you know, neoliberalism and economic rationalism have prevailed, we have lost sight of that, and all of our moves, I think, in terms of human services policy seem to you know, look more to countries like Gail's, where it's less likely than ever to be a consideration in the policy decisions. And so it's something that we're going to have to continue to bang on about, because all of the forces are heading in the wrong direction.
Okay, and I didn't really mean to put you on the spot, Paul, but I kind of did too. But Gail, you have a Bill of Rights in the United States. Does it work better in the United States? Are there things that you can actually invoke to prevent homelessness?
You know, I actually think right now the United States, for multiple reasons, is in crisis. A crisis of leadership, a crisis of direction. And I think what's unfortunate is I think we're also seeing, which normally our government does not look to global trends, which has always been a short sight of the United States. I think it has always viewed itself as a bubble or as its own entity. And you might know, as the researcher, you might know more, but we're facing the same struggles that Australia is facing. I watched ABC News had a show that you have more and more seniors or pensioners who are becoming homeless. Their spouse passes or they pass, they find themselves homeless, or they find themselves working till their 70s or 80s. We're having the same phenomenon across the United States. We now have hundreds of retirees that have sold their homes and bought motorhomes and are traveling across the United States doing piecemeal work to keep it going. So I actually think the growing economic gap is creating a crisis, which I don't know if we have the best model to look at, and it's not, from a national level, it's not being addressed. The current administration tried to defund our Interagency Council on Homelessness, which guides us at a federal level. It was blocked, but secretary and cabinet heads are no longer participating in it. So I think, I don't know if we're the best model from a federal level to look at. I think locally, communities are trying to do a lot, and I think there could be some good lessons learned. And I will just say one thing on the cost. As a country that's done a lot of cost studies, I really agree with you. It's a moral obligation. The controller in San Francisco said once to me, so if you save me all this money with incarceration or emergency room costs, do I get to then defund the hospital or defund the jail? And I said, no, of course not. You can't defund those institutions. So I actually think the cost argument's not the best road as the argument. I think it's more around outcomes, effectiveness, and morally as a society, do we think it's okay to have people sleeping in encampments or to have those rough sleepers in your business district? I think that's more the question.
Okay. All right, it's time to try and get up our last polling question and get your apps ready so that you can answer it. So if we've got it up there, the last question is, the sector talks about ending homelessness. What do we need to do to actually achieve this? By creating a national plan linking housing, homelessness, urban development and planning, we can eliminate homelessness. It doesn't matter what we do, there will always be homelessness. Link funding for services to outcomes, or develop policy responses informed by people who have experienced homelessness themselves. Let's start the clock now and see how we go on that one. Dramatic music stops. A national plan wins out hands down. I'm quite pleased by that. So a national plan gets 54.5%. Will always be homelessness, 7.5%. We need to measure everything against outcomes, 20.4%, and engage homeless people themselves in the solutions, 18.4%, 18.2%. Someone just changed their mind. All right, I think that's really interesting. I'm going to look to see if there's a question from the floor, and I'm going to try and pinch 5 more minutes of you. You were tardy coming back from morning tea, so we're going to eat into your lunch just slightly. Are there other questions from the floor that we can go to? And if not, I'll just ask the panel one more question that we've already received. I'm not seeing any hands up out there, so I'm going to... Oh, sorry, there. Didn't look low enough. Okay, can we get a microphone right down the front here, please?
I'm Barbara Shaw and I come from the Territory. Both myself and Matty Ryan are co-chairs for the Aboriginal Housing NT. We've been affected by the Northern Territory Emergency Response 2007. What's happened to us, because that Northern Territory homelessness is higher than other Australians, especially Aboriginal people. NT is 15 times, I can't see, 15 times higher in the rates, I guess, than any other state and territory. Data doesn't show the hidden homelessness amongst us or for us. Housing, houses to houses, so we still suffer overcrowding. Prior to the intervention, there were overcrowding issues. And nowadays, 10 years later, we're still suffering overcrowding. We're also suffering homelessness. As much as we're family-orientated people and we like to look after one another and making sure that there is a roof over our heads and any of our families' heads. How do you think the national plan on tackling homelessness and overcrowding is going to help First Nations of Australia?
Great question. Thank you. Panellists. Okay, we'll start with Mission.
No,
we'll go with Mission.
If I could just kick that off. I think from my perspective, the first thing is to get the national attention on that issue, because I don't think it's really fully understood exactly what you're describing and the experience of people living in the NT. I also think there's a difference in developing good policy at a national level and then going down to the implementation at a local level and getting the implementation right. And too often we don't think long and hard enough, and we don't talk to the right people, and we don't spend enough time building those relationships locally to make sure that we're working to what we're trying to achieve. And I think sometimes we find that, you know, good ideas and good concepts and some of the good policy can be ruined by our implementation process at the local level. And with the Northern Territory, with, you know, the significant challenges of both many communities, distance, just the population numbers, and even things like, I have to say, trying to get someone to repair a gate in Alice Springs. There's only 2 contractors in Alice Springs. Simple things like how do I get something repaired, let alone if I was going out 3 hours outside of Alice Springs and trying to get something repaired, how would I do that? Really does pose some great challenges, I think, in the Northern Territory. I think the first thing from my perspective is getting that fair and squarely in the national picture of how do we address homelessness and recognising, the crisis of many communities in there and their conditions of living and overcrowding.
Thanks for that. And Paul and Jenny, I think you both had comments. Jenny, we might start with you.
Well, I think it's a great question, and I think any national homelessness and housing plan has to do 2 things. It has to identify the resources that are required to support Aboriginal communities in self-determination and playing the role that they need to in ending homelessness, and they also need to identify what we as the non-Indigenous specialist homelessness system needs to do generally to improve our capacity to respond appropriately.
So we were working with states on a national approach to address homelessness, and on the 6th of October, Housing and Homelessness Ministers decided that the work that we'd been doing on that, which focused on, as I talked about earlier, a bunch of priority cohort groups, including Indigenous Australians, would be fleshed out in the agreement. And so while we've got legislation that sets out a framework of what we'll do, we'll base it around a housing strategy, homeless strategy, information. That it also says quite clearly the detail of the agreement is something that we need to work on with states, and so it will be what we work out with states about what the agreement says. And as I said earlier, there will also be things that we do with jurisdictions bilaterally, and I know that the Northern Territory has indicated they're keen to work with us, and we're obviously keen to work with jurisdictions. So unfortunately, I don't have an answer today. It'll be what discussions and how do governments manage to agree on the details of the agreement, and then what do we manage to agree on with the Northern Territory bilaterally.
Listen, we're actually about time. We really need to break for lunch. What I'd suggest, I know you've got a follow-up question. Can you come and talk to the panel afterwards to follow up that? I want to firstly really thank all of our panellists for a really lively discussion. I think that was a terrific session. So please join me in thanking our panellists.